Hello, I'm Monica Gauci. We all understand the importance of our core functioning, but one of the most amazing things about our core is that it engages, well it should engage, even before we move an arm or a leg. So I want to share with you an important test for you to be able to test yourself or others that your deep transverse stabilizing core muscle is engaging before your hip flexors. And the reason the hip flexors are important is because we use them all the time when we're walking, when we're sitting, when we're doing forward bends. And what often happens is that the hip flexors begin to dominate the transverse abdominis, firing before we move our legs. So let me show you the exercise. If you fail this movement, then it means that it becomes your therapeutic exercise. So we'll be on our backs and we're going to lift our legs so that our hips are flexed at 90 degrees and our knees are flexed at 90 degrees. We're going to put our hands underneath the curve of our low back and we're going to press our low back into our hands. What's important is that you don't lose this contact. If your low back arches away from your hands whilst you're doing this, it's an indicator that your deep hip flexor, your psoas major, is actually dominating the transverse abdominis. The hands pressing, or the low back pressing on your hands, indicates that your transverse abdominis is working. So we're going to add in hip flexion, slowly lowering one leg as far as you can that you don't lose contact of the low back on your hand. If you can go all the way, go all the way. Otherwise, you stop where you can maintain contact. So it's a slow, controlled movement without a pause. And check that you don't lift your chin so you've got good upper body posture. If this is easy for you and you pass the test, then you can try both feet at the same time. You can also coordinate using the arms with the legs. And you can also progress to using the wall so that you actually push the wall whilst you do the legs. Even better is if you have something behind you, maybe your lounge, that you can actually pull on. And in this way you actually integrate the arms and the legs into the core whilst the core dominates the movement. So beautiful exercise that is a test that course sequencing is happening in the order that it should. That also that becomes your therapeutic exercise with some progressions if you get strong enough to be able to perform each variation. So a great therapeutic tool if you're experiencing low back pain, especially in your forward bends. So I hope that helps. Thanks for tuning in. Namaste.